Well, welcome everybody. So we had a little issue with our Zoom. We had to switch Zoom, so a lot of people who signed up for this are not on, but hopefully they'll be able to watch it on YouTube afterwards. So usually when I start, I kind of ask if anybody's been on any of my lectures before, but it doesn't seem like that's going to be the case right now. So let me just get some housekeeping out of the way. This webinar is for information purposes only, and it's not to be used to diagnose or treat a condition. That being said, I think you'll get a tremendous value out of it because the thyroid is, it's a condition that is grossly mismanaged by the medical community. And it's also something that affects a vast majority of the population. So it's extremely relevant and appropriate. I think you'll get a good amount of information out of this. Okay, so let's begin. So I put this together because I get so many of my patients. They come in, and it's obvious they have some thyroid issues because of their symptoms. But they tell me that they had their labs checked and everything looks normal. So again, gross mismanagement or understanding of thyroid and what can cause things to go wrong and how to look for them. All right. So this is being recorded. So if people who are on this live, you don't have to worry about taking notes because you can use it as a reference page, because some of the stuff I'm going to go out over kind of quickly, basically for the fact that it's 4 different lectures crammed into one. I usually do this as a full day's paid seminar. And, obviously I'm going to try and whittle this down to an hour. So some stuff I may go over pretty quickly, but again, you can use this reference material and go back and look at it for things like nutritional protocols and stuff like that. All right. Okay. So what we're going to go over today is what the thyroid gland is. Okay. What's going to cause the low thyroid functions, symptoms, why it's underdiagnosed, how to know if you have a thyroid problem, what tests you want to order, okay, and what to do, how to correct it, or steps that you should be looking to take to try and get normal function to return. All right. When we go over this, it's a extremely complicated issue, right? It's so in the medical community, right, we looked at thyroid stimulating hormone, right? So very simple, right? Thyroid stimulating hormone is low, put you on Synthroid or something like that. There you go, you're all set, right? Simple, but very wrong, right? Because there's so many things that can cause a thyroid function to dysfunction. All right, so it's going to be a little complicated. So I'm trying to make it as simple as possible. But it's a much better way to deal with what's going on. Right. So where's the thyroid? Thyroid is located in your neck. It's a butterfly-shaped organ that's located right below the larynx. Okay. So palpation, if we're talking about things like goiter or if we have nodules, things like that are important. But in this lecture, we're going to be talking about functional thyroid. So we're not going to necessarily be talking about things like disease states, right? Because it's just it's a little bit beyond the scope of this lecture. Okay, but let's start with the metabolism. How does thyroid work? The reason why I want to go over this, I'm going to do just briefly, is because by learning how the thyroid works, it'll give us a better understanding on why we're ordering tests, what tests we should be ordering, why symptoms happen the way they do, and how to go about fixing it. Okay, so we start in the brain, and the brain has something called the hypothalamus, which is kind of like a messenger center, right? It does a lot more than just thyroid, but when we talk about thyroid, it sends something called TRH, thyrotropic releasing hormone, to the pituitary gland. Then, so that goes down to the pituitary, and then the pituitary stimulates something called thyroid stimulating hormone, right? Which is going to go down to the thyroid, and it's going to stimulate something called TPO. Thyrotropic thyroid peroxidase. I'm sorry. All right, which is an enzyme that's going to make thyroid hormone. Okay, and then that TPO will make T4 and T3. So it'll mostly make T4 and it'll make a little bit about T3, which we'll see in a moment. So it makes about 90% T4, give or take, and then about 10%, give or take, T3. Okay. Now, T3 is the biologically active form, and T4 is more of a dormant stage, right? The problem is that T3 has a half-life of only a couple hours. So it's not advantageous for the body to make more T3 because you don't need it all at once. So it'll make T4, and then T4 will go to various organs, various tissues, right? Most notably is the liver. So it'll convert T4 to the active form T3 in the liver. It'll also convert active T4 to T3 through an intermediary in the intestines, okay? And then to a lesser degree in other tissues like the heart or the brain or things like that, okay? It'll also produce something called reverse T3, and this is where it kind of gets a little complicated. Reverse T3 is a T3 that's not active, right? And this is important because if we look at just our T3 levels, we don't know if it's active or inactive, right? We have to look at reverse T3 to see if it's inactive, right? But we're going to talk about why you would get excess of reverse T3. And so we don't want to just rely on blood tests, because if we discount symptoms and how our body's functioning, we're going to miss half the picture. All right, so we have to take them both into account. Okay. Okay, so just very quickly, on the left is thyroxine, okay, or T4. We can see it's T4 because you have 1 iodine, 2 iodine, 3 iodine, 4 iodine. That's why they call it T4. There's 4 iodines attached to it, inactive. T3 on the right, okay, you have 1 iodine, 2 iodine, 3 iodine. You have 1 iodine that was here gets released, okay, and it gets released through that TPO, right? I'm sorry, by 5 deiodinase enzyme is going to release an iodine here. So if we don't release iodine here, but we release the iodine over here, that would be reverse T3. So the only difference between T3 and reverse T3 is where the iodine gets released. So one enzyme 5 prime, which would be here, the other iodine is 5 deiodinase, is going to be the difference between T3 and reverse T3. Okay, so when we see later talk about reverse T3, that's all we're talking about. So what does the thyroid do? Well, the thyroid does so many different things because it affects every cell in the body, right? So when we talk about body cells, it increases the metabolic rate, right? So your energy level, right? Increases oxygen usage through lipolysis, which just means mobilization of fat. Glycolysis is making stored glucose into glucose for energy production. Gluconeogenesis is making glucose for energy from things like fat and proteins. It also increases LDL, that bad cholesterol, so they say bad cholesterol uptake through the liver. So one of the things you can notice is if you have high cholesterol, especially LDLs, it's possible that it's due to a thyroid issue, right? What's the medical answer for high LDLs? They put you on a statin and you sit on the statin forever. Never to investigate why. Well, a large percentage of people who have high LDLs is because their thyroid's not functioning properly. Fix the thyroid, you increase the amount of receptors for LDL, and all of a sudden, now your cholesterol is normal. We have things like bone, okay? It'll promote bone growth, right? Because you have osteoclasts and osteoblasts, not to get too technical, but one lays down bone and the other reabsorbs used up bone tissue, right? Or old cells. So it'll regulate that. Muscle promotes normal muscle function development. So things that you can see is muscle wasting when we have thyroid issues. Heart, it'll promote normal heart cardiac activity. So it'll increase or affect, depending on hyper or hypo, the actual stroke volume or how much blood the heart is pumping out, and also circulation. So you can get things like blood pressure will change, right? You can also get cardiovascular problems from thyroid issues. Nervous system, thyroid is responsible, or at least contributes to increased synapses, or how the body talks to itself through the nervous system. increased myelination or the insulation, so you can get how much conduction of nerve, which we'll see later through some tests that you can get decreased nerve conduction, and also increased dendrites, or again, how the branches of networks of neurological activity. This becomes extremely important, especially with a developing fetus, right? Because the thyroid plays a role every step of the way with normal neurological development in a fetus. And the baby's thyroid does not kick in until the beginning of the third trimester. So if the mother's thyroid is not functioning properly, you're going to get problems with normal fetal development. Okay. In the GI tract, the thyroid promotes normal motility, right? How much the foodstuffs work its way through the system. It should take about 24 hours, give or take. Low thyroid function, it'll slow that down. You'll get things like increased susceptibility towards infection. You'll get something called leaky gut and get problems with sensitivities towards foods and things like that. Reproduction, thyroid plays a role there as well. Okay, it develops and maintains normal hormone balance, right? Controls sex hormone binding globulin. So you have problems with things like estrogen and progesterone balance. Okay, skin, because of circulation, as we talked about earlier, you'll get promotion of normal skin, hydration of skin. When we talk about skin, we also have to talk about nails and hair, because they're basically skin. They're just in a little different form, but you can think of them like skin. Okay. So with all of this that the thyroid does, we can see that dysfunction of thyroid can affect pretty much anything in the body. Okay. So what are symptoms that are associated with hypothyroid? Okay, so we talk about hypothyroid. We'll talk about hyper a little bit too, but for the most part, the body doesn't really go into hyperthyroid so much as it does hypo, but we'll discuss both. Okay, so symptoms associated with hypothyroid: fatigue, right? Because the thyroid is your generator, your energy generator. Okay, so especially in the morning, because the thyroid takes a little bit of time to get going if we have a thyroid that's stressed. You get weight gain despite adhering to a low calorie diet. Morning headaches, again, because it takes the thyroid a little bit of time to get going. So you'll get morning headaches, and they'll start to wear off as the day goes by, as the thyroid starts to pick up its activity. You'll get depression, because one of the things the thyroid does is responsible for activity of other hormones, right? That like serotonin, which is responsible for mood. You get constipation. We talked earlier about the motility. Okay, poor circulation and numbness in the hands and feet, hypersensitivity to cold weather, muscle cramps, okay, slow wound healing time, excess amount of sleep that's required to function properly. You have chronic digestive problems, such as lack of stomach acids. Thyroid is responsible for helping produce stomach acids. So you get hypochlorhydria, lack of stomach acids, which then in turn, throughout some things which we'll show later when we get to digestion, is going to cause more hypothyroid, and you get this endless like itchy, dry skin, increased susceptibility to colds and other viral and bacterial infections, and difficulty recovering from them. Some of that has to do with the GI tract, and others has to do with thyroid taking care of TH1 and TH2 immunity. Okay. You got high cholesterol, like we mentioned earlier, and poor motor control. Okay, some associated symptoms with hyperthyroid. I put hypo. The reason why I put hypo, because if you have something like Hashimoto's, Hashimoto's will cause damage. It's an autoimmune disease that probably the most famous thing that thyroid dysfunction is known for. You'll get destruction of thyroid cells, and that'll dump excess of thyroid hormone into the bloodstream. So you'll have temporary hyperthyroid, okay, even though you really have hypothyroid. So things that are associated with hyperthyroid, basically everything you would think of that increases the body's energy production, right? You got heart palpitations, inward trembling and nervousness, increased pulse rate, feeling nervous, emotional distress, won't be able to sleep, you get insomnia, night sweats. You get uterine fibroids too, and ovarian cysts, increased risk of infertility and miscarriage. This has a lot to do with progesterone. Okay, difficulty gaining weight, dry or brittle hair, hair falls out easily, dry skin, you get a low axillary temperature, right? Because our temperature is a byproduct of our metabolism, right? So it's one of the ways we're going to see later, not the best way, but it's one of the ways we can screen how well our thyroid is functioning by taking our temperature. Okay. You also get edema, especially in the face, which is called myxedema. And you'll also get a loss of the outermost portion of the eyebrows. So if you notice your eyebrows are thinning on the outer portion, probably a good idea to have your thyroid checked. Next, okay. Going back to a little bit more hypothyroid, right? Thin skin, fine features, erratic, flighty behavior, increased appetite because the metabolism is going a little bit haywire, little weight gain, if at all, shortness of breath, other endocrine disorders. Right? Thyroid makes us sensitive to progesterone, muscle tremors, you get tachycardia or rapid heart rate, heart conscious because your heart beats very with a lot of contraction, so you'll be able to feel it. Sensitivity to heat, osteoporosis, we talked about before. Thyroid is responsible for laying down bone. One of the things thyroid does is it again regulates between osteoblast activity. It also regulates a hormone called calcitonin, which is partly responsible for our calcium absorption. Okay, you're gonna get decreased menstrual flow or missed periods. Okay, loss of bowel movements. Okay, or loose bowel movements are more frequent, right? Because we talked about the thyroid is responsible for motility, and you'll get nervousness. Okay. One thing about the loose bowels is when we start getting too much diarrhea, it'll lead to something called acidosis, which is a very dangerous condition in the body. If it's too much acid in the body will start shutting down. So it's something you want to take a little bit more serious. Okay, so medical community, right? Always looking for the one causes one effect. Why do we have a thyroid problem? Well, for the medical community, it's all about TSH, right? Yeah, where's the TSH at? If it's low, we have hypothyroid. We're going to give you some kind of exogenous thyroid hormone, T4, right? Synthroid or something like that, right? But life's not that simple, unfortunately. I wish it was. All right. So what can cause a thyroid problem? Well, a number of different things, right? Irregular immune function, right? When we talk about Hashimoto's is an autoimmune problem, right? It can just show up as Hashimoto's, but it also autoimmune can show up in other areas as well, like rheumatoid arthritis or Crohn's or something like that. But Hashimoto's is an immune problem, not a thyroid problem, but an immune problem that attacks the thyroid. So you can't treat the thyroid for a Hashimoto's. You have to treat the immune system, right? And therefore, we'll control improper immune function, and we'll get the thyroid moving, provided there's not too much damage or death to the thyroid. Poor blood sugar metabolism. One of the biggest things, that and the adrenals are probably the two biggest things that's going to throw off your thyroid. Okay, we get gut infection, things, you know, like parasites or bacteria, fungus, viruses will all cause excess inflammation, throw off the immune system, will affect thyroid. Hormone imbalances, we talked a little bit about estrogen, progesterone, testosterone is in there as well. Okay, chronic inflammation, toxicity, things like heavy metals will block the iodine from being absorbed. Okay, liver congestion, it's where we get our conversion for the most part, about 60%. Poor digestive health, okay, use of hormone creams, things like estrogen take creams or progesterone. Chronic stress, which will throw off the adrenals. Environmental toxins like chlorine or fluoride, right? They will substitute for iodine and cause the thyroid hormone to be inactive. And then nutritional deficiencies, right? Things like selenium, which is responsible for making that enzyme that removes the one iodine, you know, or zinc or something like that, which we'll discuss when we get down the road about how we're going to fix things. Okay, so Hashimoto's, which is the autoimmune issue, right? The big thing with Hashimoto's is not the only thing, but the biggest thing is a gluten intolerance. Gluten, or more specifically gliadin, is very similar to thyroid hormone. So when the immune system attacks it, right, because of something like leaky gut or if there's too much in the diet or there's something undigested in the bloodstream, it'll go looking for it in other places. It'll look at thyroid, mistake it for that gluten molecule, and start attacking it. So people who have Hashimoto's definitely stay off gluten, right? You can't fix Hashimoto's and eat gluten. Okay, a gluten attack can last up to 6 months. So it's even a little bit of gluten is really not going to help you out if you're trying to fix your thyroid. You can get estrogen surges, okay, insulin resistance, PCOS, okay, which will cause more testosterone production in a female. Okay, vitamin D deficiency. Vitamin D is responsible for the receptors. Right? Vitamin D is it's a vitamin, but it's more of a hormone, and it acts on the receptors to make them sensitive to receiving the thyroid hormone. Environmental toxicity, right? Chronic infections and inflammation, genetic susceptibility to the condition, which we're going to talk a little bit more about further on down the road. And then stress, which is the biggest factor. We talk about adrenals being one of the biggest things that cause the adrenals to malfunction. Then you get autoimmune disease. Like stress suppresses the immune function, okay, promotes immune imbalances and weakens atrophies the thymus gland, which is responsible for antibodies, and it thins the barriers of the gut, lungs, and brain. Okay. So when do we screen for thyroid function? Well, definitely if we have adrenal insufficiency. And how do we know if we have adrenal insufficiency? Well, your adrenals are your stress glands. So when we talk about adrenals, we'll discuss some signs and symptoms that are associated with that. Okay, or you can do a salivary cortisol test. Okay, alopecia, or your hair is thinning or falling out. Anemia definitely would be one reason why we'd screen for thyroid. Cardiac dysrhythmia, okay, changes of skin temperature, constipation, dementia, diabetes, dysmenorrhea, okay, hypercholesterolemia, hypertension, mixed hyperlipidemia, malaise or fatigue, myopathy, vitiligo, which is like little white patches on the body, and weight gain, right? All this stuff is the stuff we mentioned previously that can cause a thyroid issue, and they'll show up here. It's a good reason to screen. Okay, so when we talk about lab testing, okay, we are going to look at labs from a little bit of a different standpoint. Most labs that people get when they look at the lab ranges, those ranges are to prevent a disease, right? And here we're taking a functional approach. So we don't want to just look at the lab ranges for a number of reasons. Number one, we want vibrant health. We don't want to just be short of disease. So that's number one. Number two, the labs, when they make up these ranges, they take an average of everybody that's taken the lab test year before. So you're getting sick people, you're getting people on medications. You're not really getting, the cream of the crop of vibrant health that's going to give you these ranges to look for. So I'm going to give you some different ranges that are more functional. They're going to be a little bit more narrow than what you might see. So check them against your own labs, and you may see that, oh, wow, my doctor said, or the lab said I was within normal ranges, but from a functional standpoint, I'm really falling outside of these ranges. Okay, so we're going to start with our TSH, right? Thyrotropin. That's that hormone that goes from the pituitary down to your thyroid. So the functional range between 1 and 2.5 milliunits per liter. Okay, if you lab measures anything, not just thyrotropin, but anything that we're going to go through is something different, you can just go online and you can convert it. There's websites that'll convert for you. Okay, so the thing with TSH is you want to get tested on the same time, right? So if you're going to get tested this month and in 2 months or 3 months from now, it should really be at the same time, because there's a diurnal peaks and valleys to it, right? It's lowest at 10 a.m. and it's highest at 10 p.m. So we don't want to get it done in the morning one day, in the afternoon another day, because it's going to maybe give you a false positive or whatnot, or that give you a unrecognizable increase or decrease in your symptoms, in your labs. Okay, it doesn't always accurately reflect the functional and tissue utilization, which is why I stress that if we just get our TSH done, it's really it's not useless, but it's close to useless because it's not telling us anything of what's going on, of how the tissues are using the hormone. It's just saying that this is stimulating the thyroid or it's not stimulating the thyroid. Okay, so for a medical diagnosis of hypothyroid, high TSH, that's king, right? If the TSH is high, even if the T4 is normal, you got hypothyroid, okay? Because the TSH should be high because it's stimulating the thyroid. We need more, we need more, we need more of your thyroid hormone, right? But there's many reasons why it could be high, which we're gonna go over in a bit, okay? So abnormal TSH cannot be considered conclusive evidence for thyroid dysfunction by itself, nor can a normal TSH be considered conclusive evidence for normal thyroid function by itself. You really need to look at, again, symptoms and some other labs, which we're going to go over right now. Okay, so why would the TSH be elevated? Well, primary hypothyroidism. So we talk about primary and secondary or tertiary hypothyroidism. Primary hypothyroidism is when we have a problem with the thyroid itself. So if the thyroid is not producing thyroid hormone, that's primary hypothyroidism. And it would make sense why TSH would be elevated, right? The brain is telling the thyroid, we need more hormone, but the thyroid cannot do it, right? Primary. Secondary would be the pituitary, and tertiary would be in the hypothalamus. Okay. So thyroid resistance. Right? We talk about thyroid resistance. We have like an elevated T3 and or T4 due to like the peripheral tissues are not really uptaking of the issues. All right, and the body will produce more from a negative feedback. Pituitary tumor, right? Tumors tend to cause increased metabolic function. Iodine supplementation can cause an increase. It can cause an increase or a decrease depending. Right? You get autoimmune thyroiditis. Okay, medications like lithium, acute illness, other medications, and Addison's, which is a adrenal problem, causing depression, primary hyperthyroidism. Okay, so if thyroid is producing too much thyroid tissue, your brain's going to say, hey, slow it down. Secondary, tertiary hypothyroidism, heavy metals, which we talked about earlier, things like mercury, lead, other halogens. Neurotransmitter deficiency like dopamine and serotonin, which will cause the TRH not to stimulate the pituitary to release TSH. Okay, so this is kind of stuff why you can't just look at TSH and say, okay, let's just replace our T4, which is Synthroid or something like that, and call it a day. Right? Our cortisol levels will throw our TSH off. Okay, chronic illness, thyroid medications, right, like Synthroid. Right, if you have too much Synthroid, which is T4, it's going to send a feedback to the body. Hey, we're producing too much, slow it down, and it's going to try and shut down the TSH. Okay. Antidepressants, and as we get older, we produce a little bit less. Okay. So total T4 is the next one, right? We talked about our two main hormones, T3 and T4. So total T4 ranges should be 5 to 12 micrograms per deciliter. Okay. Total T4 measures both bound and unbound. What we mean by bound and unbound is the body produces T4, which is not water soluble. So it needs a vehicle, right, in the blood, right? Because the blood is water-ish, we'll say. So thyroid hormone needs like a car, like a Grab, right, to take it to the tissues, right? So that thyroid is a thyroid binding globulin, right? And that's where we get the bound thyroid hormone. Now, the body can't use bound thyroid hormone, so unbound is where it's needed. So that's why testing total T4 probably not the best indicator of how well the thyroid is functioning, because your T4s could be normal, right? But most of it could be bound up because you have too much protein or you have too much estrogen in the body, which will both cause an increase in thyroid binding globulin. So T4 influence thyroid binding globulin levels. So it doesn't give you an indication of how active T4 is, unless other markers are included, such as T3 uptake. T3 uptake isn't measured a lot with labs these days. I find it incredibly useful because T3 uptake lets you know how much T3 is actually getting to the cell. Okay, so total T4 can be altered by many drugs. All right, so elevation, hyperthyroid, thyroid medication, thyroid binding globulin, which is elevated, acute illness, immune thyroiditis, and pregnancy will all cause an elevated total T4. Depression, primary hypothyroidism, thyroid binding globulin is depressed, protein deficiency, excess iodine or iodine deficiency. PCOS will cause too much testosterone and will cause a decrease in thyroid binding globulin, late stage pregnancy, and chronic illness. Your thyroid binding globulin gets elevated with things like hepatitis or liver problems, right? Heavy metal exposure, estrogen increases it. Again, we talked about testosterone decreases. Think of estrogen and testosterone doing the opposite things. So increased thyroid binding globulin with estrogen, decreased with testosterone. So free T4, it's a little bit of a better indicator, okay? Functional range on that would be 1 to 1.5 nanograms per deciliter. So a nanogram is just a billionth of a gram, okay? So 99%-ish is bound and about 1% is free and active in the T4, right? So factors that can affect total T4 won't impact the free T4. So it's a little bit of a better measure of where we're at, okay? Then causes of elevation, primary hypothyroidism, thyroid medication, acute illness, immune thyroiditis, pregnancy, thyroid resistance, other medications. Things that can cause depression or secondary tertiary hypothyroidism, iodine deficiency, late-stage pregnancy, chronic illness. So one thing to note is if we find that we have a free T3 that's elevated, and then we also do a T3 uptake and that's decreased, that's a clear indication that we have an elevated thyroid binding globulin that's too high, and so the T4 is not able to release a T3 to get into the body. Okay, total T3. Okay, so T3, remember, is that biologically active, right? And that functional range is between 115 to 185 nanograms per deciliter. Okay, measures both bound and free, and represents about 3% of total circulating thyroid hormone. We talked a little bit earlier about selenium is just needed to make that 5' deiodinase enzyme that's going to pull the iodine off the T4. So a selenium deficiency will cause a low T3 levels. So even if you get a normal T4, right, so your T4 looks fine, TSH T4 is fine, right? Well, you can't convert it into T3 because you have a selenium deficiency or a zinc deficiency or something like that, okay? Which is why it's important that we do a full thyroid panel. It's affected by thyroid binding globulin and protein alterations, but it doesn't distinguish between T3 and reverse T3 that we talked about earlier, right? You can get reverse T3 from things like too much inflammation and infection, too much stress. And so your numbers can look normal, but if you don't run a reverse T3, they're going to be biologically inactive, okay? Total T3 elevation is hyperthyroidism, iodine deficiency, total thyroid binding globulin is elevated, pregnancy, thyroid medication, autoimmune thyroiditis. And we get decreases from primary hypothyroidism, thyroid binding globulin is depressed, protein deficiency, iodine deficiency, polycystic ovarian syndrome, late-stage pregnancy, chronic illness, selenium deficiency, as we talked about earlier, and hepatic disease. So when we talk about PCOS, right, it's a loss of estrogen, right? So we get it an androgen or testosterone dominance, which is going to lower the thyroid binding globulin. And then we have free T3, which the range is 2.7 to 3.7 picograms per milliliter. Now, picogram is a 1/1,000,000th of a gram, right? We're just talking about very minute amounts. But this measures the free T3 hormone, and it's probably the best marker measuring active thyroid hormone available for the receptors. But keep in mind, just because we have this active free T3 and plenty of it, doesn't mean it's getting in the cell, which we're going to talk about in a moment. All right. But elevated reasons for T3, hypothyroidism, iodine deficiency, pregnancy, thyroid medication, autoimmune thyroiditis. And causes for depression is primary hypothyroidism, iodine deficiency, late stage pregnancy, chronic illness, selenium deficiency, and a hepatic disease. Okay, so T3 uptake. Again, it's a little bit of an older test. A lot of labs don't run it anymore, but it's very valuable. Sometimes you'll see it on a lab test as THBR. That just stands for thyroid hormone binding ratio. What they do is they put a little radioactive T3 in with a binding resin in a sample of blood, and then they measure how much of that radioactive T3 binds to the resin. Okay, so the more that binds to the resin means less that binds to the cells. Okay, and vice versa. Okay, so a functional range should be 27 to 33%. Okay, measures the amount of sites that are active or unbound on a T3. Okay, the more binding sites that are open, the lower the resin will be. So it's indirectly measuring other things that we can extrapolate, like T4 and thyroid binding globulin. So anything that reduces a binding site, such as elevated testosterone, right? There's not enough binding sites, right? There's plenty of T3, but it can't get to the cell. Testosterone replacement therapy, right, can lower T4 because it leaves very few binding sites for thyroid hormone. Anything that raises binding sites, such as estrogen or birth control pills, cause a pattern of high total T4 and low T3 uptake. Okay. Elevated reasons for T3 uptake: hypothyroidism, thyroid hormone replacement, PCOS, elevated testosterone, medications, insulin resistance, liver disease, nephrotic syndrome, that's a kidney problem. Depression would be primary secondary hypothyroidism, selenium deficiency, iodine deficiency, increased thyroid binding globulin production, okay, pregnancy, liver disease, or oral contraceptive estrogen therapy. Okay. Okay, reverse T3. Reverse T3 we talked about earlier is that inactive T3, right? The body produces it as a checks and balances, right? If there's too much T3, right? The body will produce reverse T3 to try and balance that out. Functional ranges are between 12 and 20 nanograms per deciliter. Reverse T3 is not biologically active. It's elevated by things like inflammation or stress due to infection, illness, injury, nutritional depletion. Okay, a good thing to run if we run a reverse T3 is look for a ratio. Okay, you want a free T3 versus reverse T3 ratio. It'll give you a good picture of the conversion. Okay, you want it to be greater than 0.2. When you're doing this, you want to use picograms per milliliter for free T3 and nanograms per deciliter for reverse T3. Okay, the ratio is the single greatest marker for actual tissue thyroid levels. And causes for elevation, like we already went over: hypothyroidism, inflammation, tissue injury, infection, selenium iodine deficiency, or vitamin D deficiency will cause it as well. Oral contraceptive like estrogen therapy. Okay. Primary cause for depression: primary secondary hypothyroidism, increased thyroid binding globulin production, pregnancy, liver disease, oral contraceptive, estrogen therapy, or functional hypothyroidism. Okay, we're almost done. Okay, we have a free thyroxine index. Okay, that's just a mathematical equation. You're just going to measure by multiplying total T4 levels by the T3 uptake to determine how much active T4 is available. Right? Functional range 1.2 to 4.9. Okay, if total T4 is depressed, then T3 uptake is going to be high. Okay, and then we have thyroid binding globulin. This is again that protein that shuttles T4 down to the liver and peripheral tissues. It should be between 18 and 27. Okay, It measures the amount of protein in the blood that transports thyroid hormone to the cells. It'll be elevated with testosterone. I'm sorry. Yeah. No, I'm sorry. Elevated testosterone lowers thyroid binding globulin, while elevated estrogen can raise thyroid binding globulin, right? So both of which can produce a hypothyroid because, right, elevated thyroid binding globulin, not enough free T4 to be biologically active, and low, it's going to also, the testosterone is going to affect the site of the cell. So elevated from estrogen or contraception, female hormone replacement therapy. Depression is from elevated testosterone, insulin resistance, which we'll talk about in a moment, and PCOS. So thyroid antibodies should also be tested, right? Especially if you suspect Hashimoto's. Right? The primary place that Hashimoto's is going to attack is a thyroid peroxidase antibody, right? So that should be something that should be tested. It'll also, to a lesser degree, attack your thyroid globulin antibody, and which is the transport protein, or a thyroid stimulating hormone. Okay, so all three of those should be checked, but primarily the TPO. Okay. Other relevant tests, you should do a CBC, right? A blood panel, because you want to see if you have an active infection, right? Adrenals, cortisol, like salivary cortisol level, which should be done throughout the day because cortisol levels is going to fluctuate. It's going to be higher in the morning, and it's going to tend to drop off as the day goes by. Stool test if you suspect that there's an infection, like parasite or something like that. Vitamin D3 levels. The majority of people that have a hypothyroid due to Hashimoto's will have problems with vitamin D3. Okay, and then ferritin. Right, ferritin is the iron. Right, we want to make sure that the body is able to transport nutrients in the body. So we can't fix thyroid if we're suffering from some type of anemia. Other clinical tests would be something called an Achilles reflex return. So when we have hypothyroid, we're going to get a slow release of the muscle. So let me see if I can play this right here. You'll see on the left side, the muscle doesn't just snap back, right? The foot doesn't snap back when we hit that Achilles reflex. And on the right side, we get a quick release. It contracts and releases on the left side, contracts, and it kind of slowly releases. So that's something that's indicative of a thyroid problem. And then we talked earlier about axillary temperature, right? So the old ways we used to do it is with a mercury thermometer. So we put under the axilla or the armpit, right? You can do now, you can do an ear temperature test. It should be right about the same, right? So normal basal metabolic temperature, again, if we're going to do the old school way, it should be taken for 10 minutes before you get out of bed in the morning. If you're going to do it in the ear, you just pop it in the ear, but this should be done before any movement, before you get out of bed, because as you start moving, your temperature rises. All right, if you're going to do an axillary temperature, it should be somewhere between 97.8 to 98.2 Fahrenheit. Not sure what that is in Celsius, since 36 or something like that. Okay, things to note: this is not a gold standard, or primarily it can be used for, it's used for thyroid, but other things can cause an axillary temperature problem, right? Or just a basal metabolic rate to change. Things like an infection will change your temperature. Okay, ovulation, right, will change your temperature. Right, a menstruation. It causes a low temperature, and then it goes up before menstruation, and goes down before ovulation. Right, progesterone is going to increase the body's temperature. So when the progesterone's high, temperature goes up. Estrogen's high, temperature goes down. So a woman would need to theoretically check her axillary temperature throughout one complete cycle, where a man can just do it for a couple of days and see where we're at. Okay. So this bottom sentence about if you see axillary temperature all over the place, check for perineal fault. That's something that you would take to either your chiropractor or somebody who is trained in craniopathy, right? Some cranial faults in there which would cause these to go all over the place. So it's a little bit beyond the scope of something that you look for yourself. Okay. So this is hormones based on a monthly cycle. Okay, you'll see that progesterone, which is higher over here. Okay, so this would be theoretically where the temperature is highest, and then down here is where it's lowest. So when woman is on her menstrual cycle, she has very low progesterone, her estrogen is going up, right? Temperature is down, right? After ovulation, we see that progesterone starts to increase, temperature starts to go up. All right. And next. So now that we got through all that dry morning stuff, okay, we're going to talk about 6 different patterns of hypothyroidism. Okay. One that everybody is familiar with is the primary hypothyroidism, right? There's something wrong with the thyroid gland in and of itself. Okay. But unfortunately, the medical community, that's all they do, right? Check TSH, maybe a T3, T4, give a synthetic T4, right? But the problem is if we have something like a thyroid underconversion, which is where T4 is not converting to T3, you can give all the synthroid you want, which is synthetic T4. Your numbers will look fine, but you're not converting. So it's really not helping. Your symptoms won't change. You can have hypothyroidism secondary to pituitary hypofunction, right? Things like birth control pills or any kind of estrogen type therapy is going to fatigue out the pituitary function and cause it to decrease the TSH. Okay. Also things like stress, right? Mercury, lead, toxicity, alcohol, pesticides, cigarettes, right? These will all cause an underconversion. Okay. You can get thyroid overconversion and a decrease in thyroid binding globulin. Okay, it's too much free thyroid hormone in the blood. You can get thyroid binding globulin elevation, and then finally thyroid resistance, where there's plenty of hormone, it just can't get into the cell, right? And all of these would be tackled in a little bit of a different manner. Okay, so how do we fix the body, right? So not everybody is going to need all of these, right? It's this is why I stressed before, this is for educational purposes and places to look, right? We're just trying to give you an education on things that can throw the body off and things to consider, things that you should take to your medical doctor and see if that's an area of concern, right? We don't want to just say, okay, our blood levels are off. Here's your thyroid hormone. You know, you're going to be on it for the rest of your life, right? Because things like gut repair, inflammation, sugar handling, all these things that are here are things that are going to throw off thyroid. Now, I put these in a specific order. Reason being is because the last 3, hormone balancing, right? Nutritional deficiencies and immune function, especially hormone balancing and nutritional deficiencies, we are going to address them in the areas above, right? They're on there because they in and of themselves can throw things off like that are not considered here, but we're going to address them above, right? Same thing with nutritional deficiencies. We're going to talk about various nutrition for things like gut repair, inflammation, infections, sugar handling, whatnot. All right. And then immune function, especially when it comes to when we talk about Hashimoto's. Okay. You have 2 different types of immune system. You have a fast acting immune system, and then you have a slow acting immune system, which is where the antibodies come in. If we are in a hypervigilant state in one or the other, it's going to throw us off. We need to balance that, but that's a little bit outside the scope of what you can do here, and you really need to be under supervision of somebody trained and to look for that and to correct it. Okay, so let's get into it. Okay, we're going to start with the gut, right? Hippocrates is thought of as the father of modern medicine, right? Medical doctors take the Hippocratic oath when they get sworn in. And he said that all disease begins in the gut, and we're going to see why in a minute. All right. So before we get into that, I just want to mention something before I forgot to mention earlier. When we talked about there are 3 things that we need to cause a autoimmune problem, right? we talked about genetics, right? But genetics, I know it's kind of a big deal right now. Everyone's, oh, I got genetics, my genetics, my genetics. Genetics they're just a blueprint, right? You cannot have a problem if you just have a blueprint. You need to have other things involved. And those other things would be a trigger, right? You need an environment that's going to trigger it, right? I always use an example of, I may have the genetics of Tiger Woods and to be a great golfer. But if I don't use the environment of golfing, get out there and practice, my genetics for golfing would never be turned on. I'll never be a good golfer, right? Same thing with problem like Hashimoto's. You need the trigger, right? And most commonly trigger would be, gluten intolerance, right? But other things like insulin resistance or too much cortisol, right, can all play into it. And then you need a leaky gut, right? Yeah, that's paramount. You have to have a leaky gut, which we'll see why, because everything starts in the gut. And if you don't have a leaky gut, you're not going to have these triggers. Okay, so that's where we start. So immunity and your gut, right? Most of the immune system is found in the gut, right? So a faulty gut can cause autoimmune problems, right? We talked earlier about 20% of T4 gets converted to T3 in the GI tract through good bacteria. Okay, hypothyroidism can lead to hypochlorhydria or lack of stomach acids, right? This can cause things like acid reflux and reflux. And if we don't have a acidic bolus, right, which the food when it's digesting, we don't have an acidic bolus, it doesn't stimulate the gallbladder to secrete bile, and it also doesn't stimulate the pancreas to secrete its enzymes, which are lipase, protease, and amylase, right, which is going to cause digestion. So we need that for that as well, which is then eventually going to lead towards slowing down of motility. It's also going to lead to more pathogens getting into the intestines. Okay. Poor gut health depletes the body of selenium and zinc, which we said is needed for that 5' deiodinase enzyme. It's going to deplete tyrosine, which is the base molecule of the T3 and T4. Right? And it's going to deplete iron, which is needed in an acidic environment, vitamin A and vitamin D. It'll also deplete B vitamins and K as well, right? Because B's and K's need healthy gut bacteria. It takes food about 19 to 24 hours to move through a healthy GI tract. So hypothyroidism will slow down that time and the absorption rate. And the result of constipation, which will cause bowel inflammation, malabsorption, and the growth of harmful bacteria. Okay? Constipation slows down elimination. So we're going to, through elimination, we get rid of things like hormones, toxins, estrogen accumulation, and a slowing down of thyroids will cause all that stuff to back up and accumulate within the body. Okay, so how does the problem start? Well, number of different ways, right? Certain medications will slow down transit time, right? AGEs are advanced advanced glycolylated end products, which are formed when proteins or fats are combined with sugar in the bloodstream. They're suspected and implicated in a lot of things like degenerative diseases, diabetes, atherosclerosis, kidney problems, Alzheimer's, right? They're made usually with high heating of foods. So if you get meat and you like your meat well done, right, you're going to get a lot of AGEs. Okay, you can just kind of either boil your food, steam your food. You can use an air fryer, so it'll prevent those AGEs. Nutritional deficiencies, like we talked about earlier, hypothyroidism, dysbiosis. Dysbiosis is too much bad bacteria in the intestines, not enough good bacteria. Get enzyme deficiencies, which are needed for digestion. Hidden infections, which we're going to talk about. Surgeries, you can get scar tissue. You can get decreased in motility from that. Stress is going to slow you down. Food sensitivities, which we're going to talk about in a moment. Traumas and other oral infections, which will also create things called leaky gut. Okay, so repairing it, we go by the 4 R's, right? This is not something that that I invented or developed. This is kind of well established on how to restore gut health. I should note that again, I got a lot of stuff and we're already an hour in, probably maybe halfway through. So we're skimming over this. I've done a complete lecture on pretty much all of the topics we're going to cover here. So if you want more in-depth information on gut health and restoring the gut, just go to my YouTube channel, which I'll give you the information at the end, just DocScottJahn, and you can see the lecture on gut health, okay, as well as detoxification, as well as adrenal health there as well, okay? So our 4 R's, we're gonna remove reactive foods and infections, okay? We're gonna repair the gut lining, replace digestive components, then re-inoculate probiotics. And we do it in this manner because if we do things like introduce probiotics too early, it's going to irritate the gut and cause problems. So we need to do it in a systematic way. Okay. So remove the most common type of food sensitivities, right? Now there's a couple different ways you can check for that. You can do what's called an IgG blood test, right? It's going to check for antibodies for most common food allergies, right? But that's not 100%, and it's going to cost you money. Much easier way to do it is to do an elimination provocation diet, which is you eliminate the most common allergens and food sensitivities, and then you introduce them one at a time. You're going to introduce one every 3 to 4 days, okay? But first you need to be off of it for about 3 to 6 weeks, okay? Now, our most common allergens are grains, right? Especially gluten, right? Soy, corn, and dairy, right? Those are your primaries. Now, when it comes to thyroid health, we also are going to eliminate nuts, seeds, and nightshade vegetables. They have something called lectin in them, which is something that's going to attack the thyroid peroxidase enzyme, right? The conversion of T3 and T4 adds the iodine onto them and makes the T3 and T4. So we want to eliminate those as well. And of course, we're going to eliminate sugars because sugar is just going to cause immune havoc as well as other problems in the body. We're going to eliminate those for minimum 3 to 6 weeks. The more you can do, the better, but minimum 3 to 6 weeks, 3 weeks. Okay, and then you're going to try and consider removing any other foods that you have a craving for or that you eat frequently, right? Everyone is a little different and people will have sensitivities at different areas. When we introduce foods, we want to look out for symptoms. Like I said, introduce one food every 3 to 4 days. And you can look for skin eruptions, eczema, acne, fatigue, joint pain, digestive complaints, right? Bloating, gas, heartburn, constipation, diarrhea, lung or nasal congestion, anxiety, moodiness, irritability, headaches, cold sores. These are the most common things that are caused by food sensitivities, right? If after 3 or 4 days, you have no problems, you can introduce the next food. Okay. If the problem persists after 3 or 4 weeks on an elimination diet, we want to run a GI stool or salivary panel to see if we have a parasite or other pathogen that's causing the problem. Right. A couple other things to note is Synthroid, right? Our most common T4, synthetic T4 that's put on. It has cornstarch in it and a lactose filler. So if you have some problem with corn or dairy and you're taking Synthroid, right, you're going to stimulate your intestines to be irritated, and it's going to be this endless cycle. So it really gets a little bit tricky when we talk about how we're going to heal our body. Okay, just real quick about nightshade vegetables, right? Most common, white potatoes, eggplant, bell peppers, and tomatoes. There are substitutes you can use, right? Sweet potatoes, mushrooms, celery, beets, right? We want to eliminate those for our 4 to 6 weeks. Okay, and then also consider removing things. These are not just for thyroid, but just for people in general. All these things here on the slide are things that are detrimental to everyone's health, not just people suffering from thyroid problems, right? Processed foods, foods that have additives, chemicals, coloring, flavoring, antibiotics, hormones, right? GMOs, genetically modified organisms. That's a big one, right? Especially because everything is turning towards GMOs these days, most commonly like beets and things like that. You can go on, it's Anybody wants, I'll get it for you. It's Steve Smith, I think his name is, or something like that. He's got a whole list of we call the dirty dozen, most foods with pesticides and GMOs in it. But GMOs will release what's called a BT toxin in your colon that can destabilize gut bacteria in your health and lead to leaky gut. Okay, something that we didn't have to worry about a while ago, but now we do. Okay, highly refined cooked oils such as corn, soy, and vegetable oils. These oils are not very stable, and they get rancid, and they create free radicals, which will cause damage to the body, most notably your cardiovascular system. Okay. You want to use a high heat, like a coconut oil or an avocado oil or something like that. Fried foods you should get rid of if you're eating it outside your own home, because restaurants are going to reheat the same oil over and over again, right? Their interest is profit, not health. So you're probably getting rancid oil that's going to be detrimental to health. You can eat fried foods if you cook it yourself and you don't reuse the oil. Right, but if you use a coconut oil to fry some chicken, it'll be okay for you. Okay, you want to get rid of margarine and shortening or hydrogenated trans fats. These are fats that are not found in nature. They're man-made and they're very rigid. The reason why the food industry likes them is because they don't break down. Right, so larger shelf life. Right, they also taste good, but you can leave them on the shelf for much longer because they're very rigid. Problem is when they get into the system of your body, very rigid as well, don't break down as well, right? You start to get cells that are made of these hydrogenated or trans fats, and then you don't get nutrition in the cell, you don't get waste product out of the cell, and you get DNA that starts to become, the replication of DNA becomes such that it's corrupt, and then that'll produce over and over again, and that's how cancer starts. Artificial sweeteners, especially high fructose corn syrup, right? Especially in the United States, we've been getting these commercials on high fructose corn syrup, how it's made from corn and it's natural and it's healthy. High fructose corn syrup is horrible for you, right? It pretty much does the same thing alcohol does to the liver. It'll cause cirrhosis of the liver, okay? Very common, all right? Just without the alcoholic buzz, and then alcohol as well. Okay, so leaky gut, right? When we talk about leaky gut, this is pretty much just what it sounds like. You have little holes or little leaks in the intestinal wall. Right? In this slide, right? This is the inside where these words are. This is the inside of the intestines. Then you have these cells that are these little tight junctions that prevent undigested food from getting into the bloodstream. So we can get these cells to contract, right, and get these little holes, right? And these little holes will cause foodstuffs to leak into the bloodstream where they shouldn't be there, and then the body has to deal with it. And the way it deals with that is increases the immune function, right? And then it'll start to produce antibodies towards these things. And then that's how you get autoimmune problems, and that's how you get food sensitivities. So we need to repair the gut, right? It's paramount to getting not just thyroid health, but any kind of health, right? So mechanisms that can cause leaky gut, there are a lot of them, right? There are neurological problems, hormonal problems, structural problems, metabolic problems, stress, and diet, right? So we're discussing diet now: alcohol, gluten, casein, processed foods, excess sugar, fast foods, right? Stress we're going to discuss a little later when we talk about adrenals, right? Increased cortisol is going to cause leaky gut, increase CRH, and increased catecholamines, right? Epinephrine, norepinephrine, right? Adrenaline. Metabolic, right? We talked a little bit about glycosylated end products, intestinal inflammation, which we're going to discuss a little bit more in a moment, and autoimmune conditions, which we're discussing. Okay, structural issues, right? Surgery is scar tissues, fascial adhesions. Fascia is the outer covering that like holds the muscle in place or will keep organs in place. If this is a problem that's causing some of your issues, you really need to see some kind of a structural therapist, somebody that's trained in some soft tissue work that can help relieve those adhesions and get the intestines working again. Hormonal issues are thyroid, which we of course talk about. Decreased progesterone will also cause leaky gut. Increased estradiol. Estradiol is is a byproduct of estrogen, right? When the body is trying to get estrogen out of the body, it has to go to the liver, and then the liver first converts it into a water soluble, which is estradiol, and then it's going to convert it again and get it out of the body. Now, if you have problems with liver, you're going to get too much estradiol, which is going to build up and create a leaky gut, and then decrease testosterone levels as well. And within neurological, again, brain trauma, stroke, neurodegeneration, and if anything there is an issue, it suggests getting to a functional neurologist and to deal with that issue. Chiropractors are, depending on their training, it'll probably be appropriate place to start here. Okay, so the 4 types of infections that we have: bacterial, viral, parasite, and fungus. Right, we're going to go over these rather quickly because you really need to do a stool test or blood test or some kind of test to figure out what you have. And then when you do, I'm going to show you kind of natural ways to get rid of that. Okay, the most common infections to look for: Candida, which is a fungal infection. Okay, Blastocystis hominis, which is a parasite. H. pylori, bacteria. SIBO, which is a small intestinal bacterial overgrowth. It's incredibly difficult to to deal with. Really, the only way to get rid of a SIBO is with some antibiotics. Herpes simplex, a viral. Epstein-Barr, which is probably the most common viral infection. Yersinia enterocolitica, sorry, I never pronounced that name right, is a bacterial infection. Get Lyme disease, and P. gondii is a parasite, right? So these infections can mimic thyroid problems because the immune system will attack the thyroid mistakenly, trying to attack these infections. Okay, especially H. pylori, which is similar to our TPO, and so TPO will get attacked if we have an infection there. So to get rid of infections, right? We're not going to spend too much time on the next 4 slides. They're there for you to use as reference material if you do find out you have a parasite, bacteria, viral. Okay, when it comes to parasites, my favorite way to deal with that, the bottom one actually, with the wormwood, combination wormwood, clove, and green black walnut hull. Right, find supplements online that will contain all 3 of those ingredients. All right, and you just take one week. You take one every week, one a day every week in the morning on an empty stomach. Then you take 2 weeks off and you repeat that for a couple of months, right? And go from there. Bacteria, okay. Neem is one of my favorites, okay. Also, berberine is also very effective. Other things that are not on this list, which I think I put them on, actually, yeah, I did. Borax, garlic, oregano, cinnamon, curcumin, which comes from turmeric, and ginger are all excellent to deal with bacteria. Okay, Boswellia, again, did I put that on there? I don't think I did. Right, and N-acetylcysteine, which is a precursor of glutathione, which is an antioxidant. All right, the body can't really take in glutathione in and of itself, so N-acetylcysteine is the precursor. Okay, on viruses, again, Epstein-Barr virus, as I mentioned, most common virus in the world. Right, some of the things you might want to try: elderberry, echinacea, calendula, garlic, astragalus, cat's claw, ginger, and licorice root. Okay, also want to look at maybe wild blueberries, which will help restore the central nervous system and flush out the Epstein-Barr. And last, yeast and fungal, right? Oregano, oil of oregano extract, olive leaf extract, Spanish black radish. Okay. Okay, when you're trying to rid your body of an infection, right, you're going to have what's called a die-off. Die-off is the body's way of, the shedding and of these parasites or these intruders in your body. Okay, you want to stay hydrated. You want to help the detoxification process, making sure your liver is able to detoxify, making sure that you have good motility and you're able to help bowel movements. You can use vitamin C to help move the bowels, right? Roughly 1 to 2,000 milligrams every 4 to 6 hours, but you can titrate that. If at 1 to 2,000, you're not getting loose bowel, loose stools, you can up that up 500 milligrams until you start to get a little bit of diarrhea. Magnesium citrate for constipation. Magnesium glycated does not draw water as much. Okay. General symptoms would be things like headaches, body aches, rashes, brain fog, extreme fatigue, light sensitivity, irritability, tachycardia, low blood pressure. You get nightmares, and a low-grade fever. Okay, if your fever goes above 102.5, you should definitely seek medical help. Also, bowel changes may occur, and you might get skin breakouts. Okay, so next we want to talk about repair. Okay, so key ingredients for restoring intestinal terrain, right? I'm not going to just read all of those, right? They're there for you if this is something that you require, right? Some of the things that we talk about that will help more than others, right? Omega-3 fatty acids, excellent. Also glutamine, which is going to help maintain a mucosal lining in the intestinal tract, which is important function. Okay. The multivitamin, multimineral, quercetin and turmeric will reduce inflammation in the gut. And you really need to get on a digestive enzyme, right? Because if we keep at this stage in your digestive dysfunction, you're not able to digest food enough, and you're going to keep re-irritating it. So we're going to probably talk about it in a slide or two about you need to start to reintroduce some digestive enzymes and things like that. Okay, bone broth is another excellent way to repair the intestinal wall. Okay, we'll talk about that in a moment. Then you have something called migrating motor complex. Sometimes you see MC. Okay, it's basically nerve stimulation that causes motility, right? And that will get interfered with if you have long-standing problems with your intestinal health, right? Lion's mane's a mushroom, right? That'll help repair that, okay? Also alpha-lipoic acid and acetylcholine. Okay, nutritional support for inflammation, as we talked about earlier. Licorice root, glutamine, flavonoids, okay, bismuth, right? Things like that. Also, we want to talk about the adrenals, right? If we do not support the adrenals, we cannot repair our intestines. So as we're repairing our intestines, the next thing we're going to talk about is our adrenal health, that we want to make sure that we're not hurting, keep re-injuring our intestines. But we have to get rid of the infection first, right? You can't repair adrenal health if you have an active infection like intestinal parasite or something like that. So it's important that we take care of the gut first. Okay, so again, we talked about bone broth. Now, talk about bone broth. There's two ways you can do it. You can take some large bones, which have you want the bones that have marrow in the middle, and you put it in a big pot, and you have to boil it. If it's beef bone or thicker the bone, you have to boil it longer, at least about 48 hours for beef bone. So you put it in a big pot of water. You put in a little bit of vinegar, which will help pull out the minerals. Okay, and then you're going to boil it on a low simmer. You're going to skim off the top, the fat, then stuff like that, and just keep adding water as it drops down, and you boil that for 2 days. The one problem with that is bones tend to accumulate lead. So if you're not sure if you're getting clean bones, then you might want to use a vegan bone broth. But if you know you can get bones that that have been exposed to lead, it's a great thing to repair the intestines. Okay, it's very nutritious and healthy for you, and it contains things like calcium, magnesium, phosphorus, sodium, potassium, glucosamine and chondroitin for joint health. Glycine, easy to digest, and it soothes the inflammation process. All right, so vegan bone broth, and again, here for reference, I'm not going to go over how to cook it. You can read it. When I put this up on YouTube, just stop it and copy the recipe down. So things like seaweed is a great source of omega-3s, which will help repair intestines, especially with vegans. Also, mushrooms give a good flavor to it, and it's a good source of vitamin D. Okay, coconut oil is a healthy fat and good omega ratio. Turmeric is anti-inflammatory. You have spinach and kale in there, which is good with minerals and vitamin K, vitamin A, and vitamin C, magnesium, calcium. Okay. So when we talk about bone broth, right, the body doesn't directly absorb the collagen that you're getting from the bones, right? It's just using that stuff to produce its tissues, right? But it's very healing for digestion, right? Suggest making a big pot of it, keep it in a refrigerator, and then drinking about half cup to a cup per day. Okay, when you're repairing the gut, it's a slow and lengthy process, so you need to be patient. Now, replace, we talked a little bit about this earlier, right? You need to, at least for a short time, support the body's digestive processes, right? Which means supporting the body's stomach acids, supporting enzymes, pancreatic enzymes, to bile from the gallbladder. Okay, one easy way to test if your body needs hydrochloric acid, right? Because a lot of times people think they have heartburn from too much stomach acid, which is very rare. Usually it's because their body doesn't have enough stomach acid and the food starts to putrefy and create gases in the intestines, and it'll start to burn. Other reasons would be something like a hiatal hernia, where the stomach pops up a little bit above where it's supposed to be and cause problems. If you do have a hiatal hernia or suggest it, I have I think it's on my website, a free download on how to fix that. Otherwise, it's probably on YouTube. Okay, but the way to check it is what you're going to do is you're going to take a baking soda, 1 tablespoon of baking soda in water, and drink it first thing in the morning on an empty stomach. And you're going to time how long it takes for you to burp. Right? If it's under 3 minutes, you have enough hydrochloric acid, right? Because the alkaline baking soda is going to mix with the acid and create gas, right? If it takes longer than 5 minutes to start to create a burping gas, all right, you probably don't have enough stomach acids, and you want to try and replenish that. So the way to replenish that, my favorite is celery juice. You see the bottom 3 are all suggestions on how to get your stomach acids working again. But celery juice, just straight celery juice on an empty stomach for about 3 weeks. That'll help get the body to start making its own stomach acids. But in the meantime, you're going to need to replace with a betaine hydrochloric acid, a niacinamide or B6, the zinc, which is needed for stomach acids, and some other ingredients. We talked about bile for fat digestion, and then papain and pepsin for protein digestion. So when you're taking your enzymes, you take them before meal, because they're going to interfere with the hydrochloric acid that you take towards the middle of your meal, right? You want to try and separate them out so that the hydrochloric acid isn't digesting the enzymes, okay? Okay, then lastly, when it comes to our stomach, we re-inoculate, all right? So when re-inoculation, we're talking about probiotics. Now, there's 2 ways you can do it. You can either take a probiotic that you buy in a store. I'm not a big fan of that, because probiotics are living bacteria and they're subject to heat. So if in the manufacturing process they used heat, they're going to kill the probiotic. That's why I don't understand why people use yogurt for probiotics, because they pasteurize the yogurt, which pasteurization is killing bacteria. They're trying to kill the bad bacteria, but the good bacteria die just as much as the bad bacteria. So it's not really a good option if you're trying to reintroduce a culture in your intestine. The other thing is to make your own. And when you make your own, you can make something like sauerkraut, kombucha, kimchi, pickles, anything pickled. It's very easy to do. You can also use things like kefir. Okay, you can make that yourself. Very easy to make. I'm probably going to do a video on how to make kombucha. I already have a video on how to make sauerkraut. Super easy. It's on YouTube. Just go there and you can see it. Very good for re-inoculating the intestines. All right. We're talking about bacteria, right? You need good bacteria for things like vitamin K, vitamin B12, thiamine, riboflavin, and biotin, which is B5. Okay. Without good bacteria, you're going to have problems in these, right? Vitamin K is blood clotting, things like that. B's are mostly used for neurological function. Okay. So if you're gonna buy a probiotic, you want to look for at least 25 billion live CFUs from diversified strains. Okay, there are 4 different types of bacteria classes, so you want to get a mixed strain of those. You take them twice a day for about 2 months. You're also going to look for a prebiotic, which are available in many foods, which is it contains fiber called inulin. Okay, which is included in things like artichokes, garlic, leeks, onions, chicory, tofu, and other soy products. Okay, again, we talked about stay away from soy if you're on the elimination diet. Grains such as flax are also good sources of prebiotic, right? These are the food that the bacteria need to proliferate. Okay. So we need to get that inflammation down, right? We talked about most of this stuff already, right? There are 3 reasons why the body is going to inflame, right? And when we talk about inflammation, really what we're talking about is damage, right? The body inflames because there's insult, right? There's damage to tissues, right? And that's where inflammation comes from. So it's never a good idea to take an anti-inflammatory and just say, oh, well, I took care of the problem. Right? Your body is breaking down somewhere, right? So we need to figure out why it's breaking down and stop that. And then the inflammation is going to stop by itself. Okay. So the main things are biochemical, structural, and mental emotional. We talk about biochemical. There's 3 things we want to look at: exposure and removal, right? So we already discussed exposure removal. We're going to talk about when we talk about liver health and detoxification, right? Part of that removal being good bowel movements, right? Which is, we talked about good thyroid function to keep the motility, right? That migrating motor complex, which is also subject to stimulation from your vagus nerve. We'll discuss a little bit about how to stimulate that. Okay, infection, we talked about that as well, and allergies and sensitivities. So we got most of that covered, right? A good website is the Environmental Working Group. It's ewg.org. You can go on there and you can just kind of have fun with it because there's a lot of information on there. You'll see that there's a lot of places that we're becoming exposed to chemicals, especially now when we're using a lot of cleaning products so often, right? These cleaning products can have things that are endocrine disruptors, right? They'll throw off your hormones, right? You're also going to have things like personal hygiene products, like toothpaste could have fluoride in it, which can throw off thyroid function, right? Pesticides, antibiotics, GMOs, genetically modified organisms. Okay, so if you go on that website, they'll give you a good idea of where you're getting your toxins from. You can type in a beauty product or a health product and see the exact threat that it's producing on your body. Okay? Then injury, when we talk about injury, most injuries occur from repetitive use. They're not single injury, trip, fall, car accident. Although those happen, we get much more injuries from sitting in front of a computer for 8 hours, 5 days a week, right? We're going to create little micro injuries which add up and cause insult, right? So if you have something like that, you should see a qualified professional to help deal with that. But it's not enough just to deal with that, right? It's if you deal with that and you don't correct the problem, like the example I gave you, sitting in front of a computer. If you don't look at the ergonomics of your workstation, if it's a work thing, then you're just going to keep re-injuring it. You're going to a chiropractor or a physical therapist or someone is going to help, but you're going to be right back in the same boat 6 months, 8 months from now if you're not looking to correct the problem. Okay, then mental emotional stress, which we're going to get into when we talk about adrenal health. Okay, sugar handling, right? Sugar handling will throw off your thyroid, all right? And we're going to talk about sugar handling. There's going to be 2 areas we're going to talk about. First, The just general term is dysglycemia, right? Glycemic glucose, right? Dysglycemia, the body's inability to handle glucose properly. What does it do? It's going to weaken and inflame the digestive tract, right? We just work so hard to try and restore it. You're eating sugar, you're just going to go right back where you started. It will also weaken barriers not only of the intestinal tract, but the lungs and brain as well. It drives the adrenal glands up into exhaustion, right? And then it sets the stage for hormonal imbalance, premenstrual syndrome, PCOS, and menopausal problems, right? Menopause should not be symptomatic. Any woman who's going through menopause and starts to be symptomatic, especially if it starts to become bad, you know that she has a problem with her adrenals. What happens is, as the ovaries start to shut down, the adrenal glands, which produce about 15% of estrogen and progesterone, are supposed to pick that up, right? And if they're in exhaustive phase, they can't do that. It's kind of like you know, a drug addict getting their drug removed. They start to go through withdrawal symptoms, right? So if you're going through menopause and you're getting symptoms, look at your adrenals and look at ways to help restore that. All right, we're already an hour and a half in. We're definitely probably going to pass a 2-hour mark. So I apologize for the length of it. But like I said, I'm trying to jam 4 lectures into one. So it's a lot. All right. So we're talking about clogging the body's attempts at detoxification is another thing that sugars do. Okay, and it impairs fatty acid metabolism and fatigues the metabolism. So there's 2 areas when we talk about sugar handling, right? And I do again, I have a whole lecture on this, right? Because this lecture is getting long. And so if you go to my my chat on diabetes and how to fix that on YouTube, you can get a much more comprehensive education on that. But we're going to talk about 2 things. One is insulin resistance, and the other is hypoglycemia. So insulin resistance means just that the cell can't take sugars or glucose into it because the body has been over saturated with sugar over a long period of time. The body loses its sensitivity towards insulin. You're going to get things like fatigue, especially after meals. You're going to be constantly hungry because the cells are starving. Craving for sweets, right? Your body's trying to get a quick fix, right? Waist girth equal or larger than hip girth. Usually, around the waist is where you're going to get a lot of your fat to accumulate right around the organs. Frequent urination, increased appetite and thirst, difficulty losing weight, and aches and pains all over the body that just kind of hop around. With hypoglycemia, it just means low blood sugar, right? So energy, mood, and mental function will decrease. You'll get headaches because the brain uses the majority of our glucose, and the brain doesn't store glucose, right? So the brain's going to start to malfunction. You'll get shaky and jittery, blurred vision, poor short-term memory. You're going to get grouchy, have temper, prone to crashing, especially at 3 or 4 p.m. So how do you tell where you are? Well, an easy way to do that is get a glucose meter. Okay? You take your glucose as soon as you wake up in the morning. That's a fasting glucose. It should be somewhere around 100. Anything below 70 and you're hypoglycemic. Okay? Anything above 110 and it's indicative of diabetes, right? The Diabetes Association says that it should be above 126. But really 110 if we're talking functionality, all right? So normal is between 80 and 100, okay? You also want to take it 2 hours after you eat and right before you eat, right? Because you want to see how your body is handling what you're eating, right? Is the glucose getting into the cell, or is it staying in the blood and causing damage, okay? So when we talk about our sugar handling and what to look out for, there's 2 things if you're going to look into what you're eating, right? There's something called the glycemic index, right? And that's based off of 50 grams of food. And it's how much sugar gets into the body, right? Or how much sugar gets released into the bloodstream, I should say. And then glycemic load, it takes into account how much of that food is like a serving size, right? So glycemic index can be a little bit misleading. take, for example, strawberries that I put up here as an example, right? Our glycemic index is 40, which is all right, a little bit elevated. So you might think, well, I should stay away from strawberries. But the glycemic load is only 1 because of the serving size. So you'd have to eat a lot of strawberries to get 50 grams of strawberries in you, right? Which probably not going to do. So it's considered a safe food if you have a sugar handling problem. All right. The way you get a glycemic load is you're going to multiply the grams of the available carbohydrate in the food by the food's glycemic index, and then you divide that by 100. Or you can just Google glycemic load. It's probably an easier way to do it. Okay, so for patients with hypoglycemia, well-rounded essential fatty acid supplements that include flaxseed oil and evening primrose, because those people don't do as well with a fish-based essential fatty acid like EPA, DHA. Okay, if you have insulin resistance, fish oil will be a better option with the EPA, DHA. Okay. So with metabolic syndrome, right? Sometimes syndrome X, insulin resistance, cells fatigue, and refuse entry of insulin, right? Person will feel sleepy after meals, which we discussed, hungry all day, carries a lot of weight in the belly. Insulin resistance promotes testosterone production. So you may see, things like secondary male characteristics, like a little bit of facial hair, things like that, going bald. Then the men will be the opposite. It'll be estrogen dominant, and you'll develop a little like breast tissue, hips will widen a little bit. Okay. Insulin resistance is the driving force behind Hashimoto's, right? Because of the gut factor. Okay. So it's estimated that 25–35% of the world population in developing countries suffer from some degree of insulin resistance. It's a contributing factor in diabetes, cardiovascular disease, sleep apnea, hormone metabolism disorders, obesity, and certain types of cancers. Elevated T4 uptake can serve as a confirmatory test for insulin resistance. So it's something that you might want to look into. Okay, so nutrients that help the cells regain their sensitivity to insulin, right? You can see here chromium, palladium, alpha-lipoic acid, mixed tocopherols. So if you are insulin resistant, right, I do something called applied kinesiology. So I would test I do a manual muscle test on people to tell which one works best with their body. I don't know how other people do it, but you can just try like a kind of a hit and miss. Try one for a couple of weeks, next one for a couple of weeks, or add a couple of them. And see where you're at with that, if it helps. For a diet plan for dysglycemia, okay. First rule is if you feel sleepy or crave sugar after a meal, then you have too much carbohydrates. Okay. If you do not skip breakfast, do not skip breakfast, eat starchy or sugary snacks, or eat sugar or starchy foods before going to bed. Okay, because your body will crash, and you'll probably wake up around 3 o'clock in the morning because your adrenal glands will release cortisol, because cortisol is going to take the blood out of the glucose out of the blood, and it's going to wake you up. Okay. So when we start to change our blood sugar, right, it's a little bit difficult in the beginning, especially if you have unresolved infections in the gut, because they cause foods to be craved, like sugar. Okay, you want to eat high quality protein breakfast. Side effect of adrenal hormone that are called into action into a person with hypoglycemia is no appetite. Right, so if you do have a hypoglycemia, you're going to wake up, you're not going to want to eat. Try and force yourself to eat, even if it's just a little bit of protein. Okay. You want to eat every 2 to 3 hours to keep your blood sugar stable and not give the adrenal glands a chance to rest. Okay, we're going to cut out nuts if we do have Hashimoto's, and seeds as well. Okay, a boiled egg, okay, cheese or meat, or low carbohydrate protein shake will work well. Okay, you want to avoid carbohydrate-rich foods like grains, corns, legumes, starchy vegetables like potatoes, peas, and sweets, even natural sweeteners. Okay, you want to identify food intolerances, which we already went over. Okay, you don't want to eat sugary foods without some kind of fiber, right? So if you do eat some kind of a sugary food or carbohydrate food, make sure you get proteins and fats with that because it's going to slow down the insulin spike. All right, and give pancreas a little bit of a rest and a chance to recover. We talked about if you do eat a lot of sugary foods before bed, it's how it's going to wake you up in the middle of the night because of cortisol, right? So cortisol and insulin kind of do the opposite. If you are waking up in the middle of the night, it's because you probably have hypoglycemia and you need to fix that, right? Especially if you wake up and you have to go to the bathroom and you don't pee a lot, you just urinate a little bit. It's because that hypoglycemia is going to cause the body to go into anaerobic glycolysis, and you're going to produce something called lactic acid, which stimulates smooth muscle, being your bladder. So your bladder is going to be stimulated to contract, but then you're going to go to the bathroom and there's not much that's going to come out. It's a clear indication that you're having an issue with hypoglycemia. Okay, avoid all fruit juices and carrot juices. Okay, and adrenal stimulations like caffeine, energy booster. Green tea is fine. Okay, it has some caffeine in it, but it's okay. Has EGCG, which is actually going to help repair the adrenals. You want a balanced diet, consists mainly of vegetables, high quality meats. You want to make sure they're grass fed and not corn fed. Okay, that's much better for you. And you want to eliminate those foods that we mentioned earlier. Allergens and intolerances and common food intolerances, right? We discussed this earlier: gluten, dairy, eggs, corn, soy, yeast. And then eliminate parasites, toxicity, heavy metals, pathogens, all the stuff we discussed earlier. For hypoglycemia, here's the list of nutrition that'll kind of balance it out: chromium, adrenal gland extract, choline, okay, liver gland, pancreatic gland, inositol, L-carnitine. One thing that's not on here is cinnamon is also good for balancing blood sugar. All right, coenzyme Q10. Person goes back and forth between insulin resistance and hypoglycemia. What we want to do is we want to treat the insulin resistance with meals and then the hypoglycemia between meals. Okay. When glucose can't get into the cell, it circulates in the bloodstream and it damages arterial walls and the brain. The body converts the excess glucose into triglycerides and stores it as fat. This process is very energy efficient. It causes a lot of energy, and so that's why it will cause you to become sleepy. Okay. Furthermore, insulin resistance decreases the body's ability to use stored fat for energy, and the process also raises your serotonin levels, a brain chemical that can induce drowsiness. Okay. Insulin resistance creates a serious risk for heart disease and diabetes, as well as low thyroid function. Okay. So fasting for insulin-resistant patient. So blood tests for fasting glucose and lipid elevation, right? Cholesterol, triglycerides, HDL and LDL cholesterol for determining effective protocols, right? We went over how we can kind of do this at home with a blood glucose meter, okay? We don't want to fast if we are hypoglycemic, only if you're insulin resistant. Fasting for insulin resistance is actually quite beneficial. It gives the body a chance to rest and recover, okay? But not if we're hypoglycemic. Okay. When we do fast, we want to use a lemon juice with organic maple syrup. Organic maple syrup grade B has a little bit more B vitamins in it. A lot of people will look at this as similar to something called Master Cleanse. Okay, but the Master Cleanse uses cayenne pepper, which can irritate the intestines. So if you are problem with your GI tract, you probably want to leave that out. But you want to sip it throughout the day to keep your blood sugar from dropping too much. All right, just make a big batch in the morning and just slowly sip it throughout the day. Okay. And as we said before, you can use green tea, but stay with other stimulants. Most people with insulin resistance have multiple food sensitivities, which we discussed already. So those should already been taken care of before we get to this stage. So if you need to eat some kind of a vegetable during your fast, right? So eat something that you barely eat before. So it's highly unlikely that you're going to have a food sensitivity to something that you're not exposed to on a regular basis. So coming off of the fast, stick to an anti-inflammatory diet, right? Avoid sugars, grains, processed foods for 3 weeks. If you don't feel better, check for infections like parasites, bacteria, or overactive immune system. All right, we're getting there. So restoring adrenal function, right? So adrenals are your stress hormones, right? So anybody who's overstressed, you're going to have adrenal problems, right? Your adrenals also provide you with cortisol, all right? And cortisol not only weakens your hypothalamus and pituitary, right, which stimulate your thyroid function, but they also tend to irritate the GI tract, okay? So it's important that we can't keep stimulating the adrenal glands. When we talk about stress, right, the adrenal glands are there to get you out of fight or flight, get you out of danger, right? They're supposed to be, right, you see a tiger or something back in the olden days, right? You get excess of energy and you prepare for battle, right? Then that stressor goes away and the body returns to normal, right? The problem is that stress is stress is stress. So if it's mental, emotional stress, if it's chemical stress, if physical stress, body deals with it all the same exact way. It's going to deal with it as if you're in a fight. Now, if you have mental, emotional stress all day, every day, your body's constantly preparing you for a fight. It's constantly mobilizing energy and it's shutting down vital processes for healing and repair in replace of trying to fight and keep you alive in that moment. And that's so much damaging to the body because there's all this mobilization of energy that got nowhere to go, and it starts to damage the body. So we have to remove the stress. And there's different ways to do that, which we'll discuss towards the end of the adrenals problems. But let's first talk about what you're going to look for, right? With adrenal stress, we're going to look for sugar cravings, right? Because it's energy. Thinning skin or eczema, feeling wired and tired, carrying extra weight on your stomach again, high blood pressure, elevated blood sugars, right? Difficulty in getting to sleep at night or waking up often throughout the night. Okay, the ability to respond to chronic illness is influenced significantly by your adrenal glands. So somebody who's constantly sick, right, probably could be an adrenal issue. People with blood sugar handling problems almost always have an adrenal function. Okay, one of the most common overly looked cause of adrenal fatigue is infection, which we already addressed earlier. So hopefully you had that taken care of before you get to this stage, because if you don't take care of the infection, you're never going to get your adrenals back to where they should be. Okay. Adrenal overdrive symptoms, right? If the adrenals are in an alarm state or they're hyped, you're going to get allergies, anxiety, irritability, depression, carb craving, difficulty focusing, digestive problems, eczema, hormone issues, insomnia, loss of libido, high blood pressure, cholesterol, insulin resistance, Hashimoto's, osteopenia, which is thinning bones, right? Osteoporosis, PCOS, endometriosis, infertility. So a lot of this stuff, again, we see this with our thyroid issues. Adrenal fatigue, right? We're going to get allergies, immune disease, decreased concentration, memory, depression, fatigue, frequent colds and infections, increased inflammation and pain, loss of ambition, motivation, low blood pressure, hypoglycemia, irritability, and no appetite in the mornings. All right. So we have 3 stages of adrenal dysfunction, right? So alarm phase, which is the initial phase. You're going to get exhaustion, alarm, resistant, and exhaustion. Okay, so alarm stage, you really don't have to do much about it except make sure that you eventually try and reduce your stress load or your triggers, right? But with alarm stage, we see cortisol and DHA are high. Okay. Insulin resistance is common at this stage. You'll self-correct if we move the stressor. Okay, but there are some nutrients you can take for adrenal health. Okay, they're around the insulin response. Stuff we mentioned earlier: chromium, vanadium, alpha lipoic acid, tocopherols, which are E vitamins, magnesium, biotin, zinc, inositol, and gymnemia sylvestri. And then below that we have nutritionals for dealing with stress response. Right, we're not going to just read all that. You can see them there. You just pause the screen and read them if you need. Okay. Then we hit our resistance stage, and that's where Our cortisol is high, while DHEA is normal. Right? DHEA is a precursor for things like estrogen, progesterone, stuff like that. Prolonged stress of the body steals pregnenolone, right? Something called pregnenolone steal. Pregnenolone, again, is a precursor, right? So the body's going to steal the pregnenolone to prioritize stress hormones. And then there's going to be not enough pregnenolone to make estrogen, progesterone, testosterone. Okay, normal pregnenolone makes sense. All right, that's what I just said. Sex hormones, as a result, hormone imbalances arise, commonly causes things like PMS, infertility, mixed menopause, and PCOS. Okay, so when we are in an adrenal stress state, this is going to throw off everything that we're trying to do to correct our thyroid function and, by extension, hormones and whatnot. And finally, the exhaustion phase. This is where prolonged stress has been going on. The adrenals just can't keep up with the demand. Think of it like the pancreas with diabetes, right? You just can't keep up with the type 2 anyway, not type 1. It can't keep up with demand, and it just eventually kind of peters out. Cortisol will be low and DHA is low. Right? Adrenals can no longer adapt to stress. Cofactors needed to make cortisol becomes depleted. Same nutrient protocol as before. Okay, you might want to add like a liposomal cream. It supports low adrenal function. Key ingredients would be licorice, B vitamins, and other nutrients to support adrenal health. Here we'll get normal cortisol and elevated DHEA at times. Okay, most important with adrenal recovery is to stabilize blood sugar, which we mentioned already, and to investigate and remove the source of stress. So there's a couple little relaxation techniques you can do. Some of them are quite effective, right? Anybody who knows or studied something called neurolinguistic programming, there's very effective ways to do that. I have a YouTube video on how to do this, so I'm not going to go in depth on it, but anybody who wants to learn it, just go on my YouTube channel again, and the title of it is something about how to change your mood or something like that. All right, you'll see it there. It should be easy to find. If not, just shoot me an email and I'll send you the link. All right, but you're going to use an anchor, and you're going to use just some various visualization techniques to help your body get off of that fight or flight. There's also one I didn't mention here that is extremely effective called emotional freedom technique. Basically what happens is your body is constantly looking at your environment and comparing it to past life experiences, right? And trying to interpret if something is a threat or how to respond to it. Now, if you have past experiences that are negative, your body's going to become hyper aware, right? A good example is if when I was a child, my mom took me to the grocery store to go grocery shopping, and I'm sitting in the grocery basket, and she just leaves me there for a second to go grab a can of tuna in the next aisle. As a kid, I feel like I was abandoned because I don't see my mom. So now I have a fear of abandonment that gets triggered whenever a similar event. My brain just kind of tagged that because it was very traumatic and it was dangerous. So fear of abandonment comes up anytime a trigger kind of puts me in the same or similar response to being in a grocery store, whatnot. So you can actually reprogram your brain through something called emotional freedom technique to kind of remove these little triggers that we have that create a fight or flight stress response. Okay, again, go on YouTube and just look for emotional freedom technique. Right, the developer of it is a man named Gary Craig. Okay, very easy to learn. Take about 2 minutes to do. Especially useful if you're in stressful situations, like you have to give a talk in front of people, or you're on a date or anything like that. You can use this technique and it'll instantly calm you down. Okay, aerobic exercise, extremely effective at stress reduction. Okay, it has a host of other benefits, but stress reduction, because we're talking about adrenal function here. What we're going to do is minimum 30 minutes brisk walk. That's it. All right, we don't need to exhaust ourselves through extreme strenuous activity for 2 hours at a time to get the health benefits of exercise. Now, you can do that if we're looking for aesthetics and fat burning or whatnot, but for the health benefits of increasing energy, decreasing stress load, decreasing cholesterol, decreasing the risk of cancers, cardiovascular disease, all these things. All it takes is a half an hour brisk walk a day, right? Not much to have to do, okay? And if a person needs DHEA, right, that precursor hormone, you suspect adrenal dysfunction and the pregnenolone steal that we talked about. But long-term use of DHEA will convert into testosterone in females and estrogen in males. So we don't want to exceed that for more than a month at a time. Our goal is to get the body to work itself, right? If we're, we talk functional medicine here, and if we're just replacing a medication with some kind of nutraceutical, as opposed to fixing the body, we're basically doing the same thing that the allopathic or medical community is doing, is we're substituting without correcting, right? We want to make sure we get the body to do the work itself and the body to function normally, okay? And lastly, we want to talk about sleep, right? Sleep is so important for healing and repair process. We want 8 hours of uninterrupted sleep. The room should be complete darkness, right? Because without complete darkness, the body is not going to release melatonin, right? The sleep, the hormone that puts us to sleep, right? No electronics 1 to 2 hours prior, because blue light from things like computer screens will cause brain waves to go into an excited state. If you must use some kind of computer screen or something like that, try and get a blue blocker glasses, right? Will filter out the blue light, and hopefully it'll keep the brain from going to a hypervigilant state and allow you to get restful sleep. All right. Okay, so final one we're going to talk about today is restoring detoxification pathway. Okay, so I believe I have a whole video on this as well. Like I said, we're cramming a whole lot of information into what was supposed to be an hour, but now it's going on 2+ hours. So I apologize. I hope some of you are still with me. Okay, restoring the detoxification pathway. The majority of the detoxification pathway we're going to discuss is the liver. Okay, but there are others, right? You can detox through the lungs, through respiration is a detoxification pathway, through the skin, through sweat, from exercise, a detoxification pathway, through the intestines, right? Proper bowel movements at least once a day is a detoxification pathway. But when we're going to talk about the liver, okay, so restoring the detoxification pathway, I always recommend a liver gallbladder flush. Okay, we want it because most people's liver and gallbladder are congested. We kind of want to get that moving. You get chronic exposures to low-level chemicals in the environment, gets linked to things like hormonal and fertility problems and inflammation. So by flushing this out, we're going to help the body ease the stress that it's under. Okay, so we cut out all fats and irritants from your diet during the flush. It's best to go on a juice fast. You can just Google mean green juice fast, and you're going to do that for about 5 days prior, because what we want to do is we want to keep the body as clean as possible, and we don't want to expose the liver and gallbladder to any fats when we flush it. All right. If you don't want to go on a juice fast, you may just make sure you eat very clean, a lot of salads, but stay away from like fats, even olive oil and things like that. Okay. For 5 days, you want to drink apple juice or somehow get malic acid into your system. Malic acid will help soften any kind of gallstones that are in the liver or gallbladder. Okay. When you do that, though, I recommend keeping a toothbrush handy, because if you're drinking the apple juice, it's gonna leave a grit on your teeth that will become annoying very quickly. So bring a toothbrush with you. Okay. On the 6th day, after you drink your apple juice, 1:30 p.m., you're gonna drink a saltwater solution of Epsom salt. Then at 6 p.m., you're gonna do your second one. I warn you, this does not taste good. I tend to skip that step. It's probably best if you don't, because the Epsom salt will help dilate your bile tracts to help flush out and make sure no stones get stuck. And then in the evening, you're going to take about a half cup of extra virgin olive oil and the juice from 1 grapefruit. Lay down immediately on your side, on your right side. On your right, keep your right knees. Oh, I'm sorry. On your right side, keep your knees towards your chest. for about 20 minutes or so. Sit still, try not to move, maybe sleep. Okay. Next day, you should drink 1 cup of salt solution immediately upon awaking. This will also help stimulate your bowels to flush out the gallstones that are coming. If you do not drink the salt solution, you can take something called senna or any kind of other kind of laxative to help keep the bowels moving. You need those bowels to move, otherwise you're just going to be reabsorbing toxins. Okay. Okay. Salt water flush is 4 tablespoons of Epsom salt combined with 3 cups of water. Okay, you're going to drink 1/3 of the solution. Okay, that's a yoga exercise that helps stimulate bowel movement and intestinal motility. Okay, you can just Google that. You don't have to do it. I tend to skip it. And then repeat. Okay, again, I want to keep the bowels moving. If you choose to do mean green fast, let's keep your bowels moving with either a saltwater flush or laxative like senna. Okay, so I have a little bit more in-depth way to do this. I was just trying to keep this as simple as possible for this lecture. So anybody that does want to detoxify the pathway, just go to my website, DocScottJahn.com. There's a free download on a proper way to detoxify your liver. Okay, it'll go more into depth on how to do this. Okay. In addition, we want to use there's a really old remedy with castor oil packs, which is going to help stimulate elimination, assimilation, lymphatic circulation, immune function, as well as coordination of organs and gland systems. Okay, what you're going to do is you're going to get some cold pressed organic castor oil, a flannel or wool cloth. You saturate that with the oil. Okay, and then you put it over your liver, and then put a piece of like plastic wrap on top of that, and a bath towel, and then some heat source like a hot water bottle or a heating pad. Okay, and that's gonna help stimulate the blood flow and detoxify the liver. All right, kind of let's see where we are. Place flannel cloth, cover abdomen, cover plastic bath towel, place heat, relax for 30 minutes. Okay. So you repeat this for 3 days, and then take the 4th day off and do this for 3 weeks. Okay, more or less, right? So 3 days on, 1 day off. When you're finished, you just you can reuse the flannel or a cloth. Just wrap it in the plastic wrap, and just stick it somewhere. I usually stick it on a shelf or something like that. And then just next day, take it, unwrap it, and do it again. You're able to use 1 flannel cloth for a while, a week or 2 at least. So nutrition that helps restore liver pathways, right? Everyone knows the favorite milk thistle, right? There's also things like dandelion extract and molybdenum. There's things like dandelion root we talked about, Gudo cola nut, Panax ginseng, glutathione, glycine, L-acetylcysteine, methionine. Then phase 2, methylation, right? We talked about estrogen, right? How it turns into estradiol after phase 1. We needed to go to phase 2, otherwise it's going to go right back in the system. Okay, and you can see the what we need for that. Pretty much same stuff: dandelion root, milk thistle, ginger is also going to help, taurine, beets, vitamin C. Okay. And then nutritional support for optimal estrogen metabolism. Okay, is right there. Sorry, I'm getting a little tired, so you can read them. All right, finally, all right, the last thing is make sure that you are not suffering from anemia, right? Anemia will kind of thwart all this stuff that we just went over, right? So anemia is a deal breaker for nutritional support of any kind, right? Because the blood needs to carry the nutrition, and without proper iron, it can't do that. Anemia starves the body of oxygen. Always consider anemia. Anemia can be due to various factors, including pernicious anemia, which is an autoimmune. The body lacks intrinsic factor, which is needed for absorption. Some anemia will not respond to iron due to red blood cell breakdown, or too much iron in the body is also toxic. So we want to be careful. We just don't want to randomly give the body iron. So when we look at anemia, what you want to do is in a clinical setting, you can just checked fingernails, right? You should see nice red fingernails, and when you put pressure on it, it should refill instantly. If it doesn't, right, you want to maybe consider that you might have a problem with anemia. Iron deficiency anemia can be due to excess bleeding, right, from mostly from menstrual cycle. It can be peptic ulcers, hemorrhoids, hiatal hernia, which we talked about earlier, large dose of aspirin or NSAIDs, which are non-steroidal anti-inflammatories. It can be due to infection as well. Okay. And healthy hormone production depends on essential fatty acids found in cold water fish and unprocessed nuts and seeds. Essential fatty acids also promote proper cell communication, brain function, and more. The ideal ratio of omega-6 to omega-3 is 3:1 or 5:1, somewhere in that range. But the average American diet is 25:1 due to processed vegetable oils. So omega-6 is inflammatory and omega-3 is anti-inflammatory. So we want more omega-3s than omega-6s, okay? And that finally brings us to the end. All right. So this was the first time I tried to whittle down a complete lecture into, well, it's supposed to be an hour, but it's now but a two-hour talk. I know I went through it really quickly, which probably, people glazed over due to boredom. But it's recorded, so you can go back and use it as reference material. But my hope is that you see thyroid function as more than just look at your TSH, put you on Synthroid, forget about it, right? There's always a reason why the body is dysfunctioning, and we need to figure out what that is, right? Regardless, because otherwise you're really going to set yourself up for disaster down the road, okay? I hope you guys found this informative, and if you did, consider checking out my YouTube page, because there's a lot of other good stuff on there, stuff that goes into more in-depth information on most of the stuff we covered here, as well as other good stuff. Join my Facebook community, and you'll get things like discounts, and we'll talk about other stuff, and be informed about future chats. I think the next one we're going to do is towards the end of December. I don't have a date exactly yet. But it's probably going to be on discussing New Year's resolutions, what to do with them, how to keep them, and so forth. If anybody does have any ideas and want to see anything in the lecture series, like I said, I do it once a month, probably towards the end of the month. Just shoot me an email at doc@DocScottJahn.com and tell me what you want to see. And if there's an interest in it, I'll put a lecture together for you guys, and we can talk about it. All right. So thanks for sticking with me, anybody that's still on this chat, and I will see you guys next month. All right. Have a great day. Take care.